Good evening, everyone. My name is Tony Mancuso, and I serve as the Communications and Outreach Senior Specialist for the Summer Health Professions Education Program, also known as SHPEP. For those of you who are unaware, SHPEP is a free 6-week summer enrichment program for college freshmen and sophomore students who are interested in the health professions, and our application opens November 1st. To learn more, please visit shpep.org. Tonight, our audience is comprised of SHPEP alum, pre-health advisors, and anyone who's interested in learning more about the physical therapy pathway. That being said, I'd like to introduce Ryan Bannister. He serves as the Director of Centralized Application Services and Student Recruitment at the American Physical Therapy Association and will lead tonight's session. Please be sure to use the Q&A feature to ask any questions throughout the presentation. And as always, SHPEP webinars are posted on our YouTube channel within a week of the live viewing. Ryan, feel free to take it away.
Thanks so much, Tony. I appreciate you inviting me to do this webinar tonight and to let me speak with your attendees. So as Tony mentioned, my name is Ryan Bannister. I'm the Director of Centralized Application Services and Student Recruitment at the American Physical Therapy Association. And I oversee all three of our centralized application services for our Doctor of Physical Therapy education programs, our Physical Therapist Assistant education programs, and our Physical Therapy Residency and Fellowship education programs. All of those programs are combined under our PT Moves Me student recruitment campaign. You can learn more about PT Moves Me by visiting our website at apta.org/PTMovesMe, and that link will be included at the end of this presentation. But tonight, I want to talk to you about the profession of physical therapy. We'll learn a little bit about what the profession of PT is and why it's a great career option for you to consider. So why don't we dive right in and start with some of the basics? What is physical therapy? Physical therapy, as you can see on the screen, has a very formal definition, but in short, it's really something that helps people move better. It helps people improve their movement and physical function to prevent and/or treat injury and chronic disease. So in the big picture, physical therapy is vital because it keeps people moving, and movement is one of the keys to life. Think about your life and how it would change if you couldn't move, or if your mobility was limited in a way that you're not used to. Movement doesn't just refer to running or dancing or walking or any of those types of things. We're talking about the ability to sit and stand, or play, or bathe yourself, or breathe, or even just keep the blood flowing through your body. Physical therapists help keep people moving so they can live life to the fullest. So now that you know what PT is in the broad sense, why don't we talk a little bit about who physical therapists are? They are licensed healthcare providers who help people move better. They are educated with a professional doctoral degree. So yes, PTs are doctors, and they're trained to examine, diagnose, and treat movement dysfunction, as well as to help optimize movement function. They are anatomy and physiology experts. They have an in-depth knowledge of the body's muscles, bones, nerves, ligaments, tendons, blood vessels, fascia, etc. They are movement experts and anatomy physiology experts, and they know how all of these systems and things work together to keep people moving. Physical therapists use movement as well as exercise and modalities and techniques such as heat, cold, electrical stimulation, manual therapy, and light therapy to help treat movement dysfunction and prevent injuries. It's a lot to take in, I know. There's more to PT than just physical therapists, though. There is also the profession of physical therapist assistant. They are also licensed professionals and are certified clinicians that help provide physical therapist services, but under the direction and supervision of a licensed physical therapist. Physical therapist assistants are not trained to examine or diagnose the same way a physical therapist is, but they are trained to assist with the implementation of patient care and treatment. There's a big difference that needs to be pointed out here, though, between a physical therapist assistant and something else you might have heard of, which is a physical therapy aide. Physical therapist assistants, or PTAs for short, are licensed or certified clinicians that have been formally trained to provide healthcare services, while a physical therapy aide performs non-medical tasks and assists with clinic duties. They do also work under the supervision of a PT or PTA, but they are not in any way licensed or clinical clinically trained, nor are they providing healthcare treatment or healthcare services. So something to note there. So now that you've got a better understanding of what physical therapy is and who PTs and PTAs are, we should do a quick overview of what it takes to become a PT or a PTA. There are two pathways you can choose to enter the profession of physical therapy. The first is you can choose to be a physical therapist. Second, as we talked about, is PTA. Both career pathways work with patients. However, as mentioned before, physical therapists are trained to examine, diagnose, and treat patients, while PTAs are trained to assist physical therapists with strictly patient treatment. So physical therapists must obtain a bachelor's degree first, and then a 3-year clinical doctor of physical therapy degree. If you've seen a physical therapist in the past, we do always like to point out that the profession is celebrating its 100-year anniversary this year. And if you've seen a PT, they may not have been a doctor of physical therapy. The profession started out as a baccalaureate level profession, moved to master's, and for the last 15 years or so has been a doctoral level profession. So there are still practicing physical therapists out there who are not doctors, but hold a bachelor's degree or master's degree, although some have gone on to pursue a doctoral degree since then. But we always like to clarify that anyone becoming a physical therapist now will graduate with a doctor of physical therapy degree. In terms of physical therapist assistants, they need only obtain a 2-year associate degree to become eligible to sit for their exams. So to be a physical therapist, you must complete a professional doctor of physical therapy degree like we talked about. But to be eligible for the license exam, it has to be a DPT program that is CAPTE accredited. So upon the completion of the program, you'll sit for your National Physical Therapy Examination, or NPTE for short. So let's take a little bit of a deeper dive to look at what DPT education entails. Obviously, there's a level of time commitment involved here. To enter a DPT program, you must first obtain a bachelor's degree. And then most DPT programs will take you 3 years to complete. There are some guaranteed freshman entry programs that you could have entered at the start of your career. There are some 3+3 programs and accelerated 2-year programs, but the bulk of programs are 3-year programs that will require you to complete a bachelor's degree first. In terms of preparing for a DPT education, the DPT program curriculum is very heavy on basic science. So having a strong science foundation is helpful. We're talking about biology, chemistry, physics, anatomy, physiology, biomechanics. Those are all courses that DPT programs are going to want to see. You're also going to want to make sure that you have a good understanding of the profession and what physical therapists do. You can do this by shadowing a PT, volunteering in either a clinic or at events such as the Special Olympics. You can find a PT, PTA, or a student PT or PTA mentor. And you can even go so far as to just look at the APTA website at apta.org. There is a ton of great resources and videos there to help you understand what the profession is as well. So once you've decided you want to go to PT school, you need to apply. Most DPT programs require prerequisite courses, physical therapy observation or shadowing hours, and letters of recommendation as part of their application process. 95, almost 96% now of the doctor of physical therapy programs in the country require applicants to apply through the Physical Therapist Centralized Application Service, or PTCAS. You can visit ptcas.org to get more detailed application information and view our directory of programs, which contains all of the prerequisite and application requirements, as well as program profiles for every program that participates in the CAS. It's a great resource when you're first starting to explore if PT programs are right for you. You'll also find information on average GPAs, average GRE scores, incoming class profiles. It's a wealth of information. So once you've been admitted, what does the curriculum look like? Well, most DPT programs have a combination of didactic or classroom coursework, labs, and clinical coursework. In addition to the classroom learning, you're going to have very intensive sessions on anatomy and physiology, both in terms of coursework and labs. You'll also be required to complete clinical rotations in your 3rd year. And once you've finished that, what's left is you get your degree. Upon completion, as we've mentioned, you'll earn your Doctor of Physical Therapy degree, and then you'll be eligible to sit for the National Physical Therapy Examination, or the NPTE, which makes you eligible to obtain licensure to practice in all 50 states. So that's a quick overview of what DPT education looks like. So what are the primary content areas in the curriculum? That's a question we get a lot. They are pretty varying. You can see on the screen here that these are just a few examples of content areas covered. As you can see, it's a mixture of science and the humanities. You do need a strong science foundation to go into PT, as I mentioned, but it's also important to know how to communicate and empathize with your patients. A lot of them have been through tragedy and are experiencing some sort of emotional suffering along with their physical injuries. So it's important to understand how to communicate and empathize with them. It's also really important to have some strong ethical values, so you will frequently see ethics and values courses as a part of the curriculum as well. So if we look at some of the common application requirements, these often include prerequisite courses such as anatomy, physiology, biology, chemistry, physics, and statistics, as well as some English courses at most programs. The GRE is a common requirement. Over 80% of DPT programs do require applicants to complete the GRE exam. Beyond that, there's also, like I mentioned, the observation or shadowing hours. Over 90% of DPT programs still require applicants to have at least a minimum number of shadowing or observation hours, or highly recommend them. The range there goes anywhere from 5 hours at the low end to over 250 hours for some programs. So it's a wide range. Again, all of that information is available on the directory, the PTCast directory, to find out the exact number of hours programs are requiring or recommending. In addition to that, there's letters of recommendation. Almost all, 99% of programs do require at least one letter of recommendation to be submitted with your application. The average is 2 to 3, and they are typically requested to be from a physical therapist, a professor, a supervisor or employer, a teaching assistant, a physical therapist assistant, or an academic advisor. Those are the most common references it will accept. In addition to this, some programs do request a supplemental application. About 35% or so do have supplemental application requirements. And then again, just one more plug there: to go learn about all of these requirements, visit ptcast.org. So we've talked about the PT pathway. Let's talk a little bit about the PTA, physical therapist assistant pathway. To be a physical therapist assistant, you must complete a 2-year associate degree from, again, a CAPTE accredited, and that's the Commission on Academic Physical Therapy Education, CAPTE. So a CAPTE accredited physical therapist assistant program. Upon completion of that program, you'll again take the National Physical Therapy Examination for PTAs. So looking at this, again, the time commitment here: to enter a PTA program, you need to obtain a high school diploma or a GED. Most PTA programs take 2 years to complete. It is an associate level program. However, some programs will accept transfer credits, so it could take less than 2 years. In terms of the preparation to prepare for a PTA program application, you'll also want to have a good understanding of anatomy and physiology, just like with the DPT. You'll want to make sure that you have a good understanding of the profession as well and what physical therapist assistants do. And same as DPT, you can do that by shadowing a PT or PTA, volunteering, finding a mentor, etc. In terms of applying, there is also a CAS, a centralized application service, similar to PTCast, called the Physical Therapist Assistant Centralized Application Service. This is relatively new. It just launched about a year ago. It's starting its second application cycle. So most programs are not yet using this CAS, but we imagine that as it grows up and gets older, more programs will come on board. So it's something to be aware of there. In terms of curriculum, the PTA programs do have a combination of didactic and classroom coursework, labs, and clinical coursework, just in a more condensed fashion. And then lastly, the degree. Upon completion, as we've mentioned, you'll earn an associate degree, which will make you eligible to sit for the NPTE exam, which makes you eligible for licensure in all 50 states as a PTA. So some primary content areas in PTA curriculum. Things include, again, you'll see science and humanities courses included here. Both PTs and PTAs spend more time with patients than most other health professions. So possessing a strong communication set of skills, as well as ethical and behavioral skills, is as important as possessing clinical skills, like we talked about. Common PTA application requirements mirror those of DPT programs for the most part. You'll see prerequisite course requirements, including anatomy, physiology, and more commonly English as well. You'll see a lot of English prerequisite requirements for PTA. Observation hours still might be required, but in numbers far lower than that of DPT. Letters of recommendation, similar information, they most commonly are requested to be from a physical therapist assistant, or supervisor, or academic advisor. Official transcripts are required, and the difference here is not only are they required for your post-secondary institutions, if you have any, most PTA programs are also going to require your high school transcript, whereas DPT programs do not. Other programs, again, will require localized supplemental application fees or fee waivers. And then, again, more resources available here on the APTA website or the CAPTE website. So some general tips when preparing to apply to a DPT or a PTA program. Most programs will list a deadline date, but this is just the last date that they will accept applications. And no matter what profession you're looking to apply to, this holds true. Don't wait to the last minute to apply. The longer you wait, the less your chance of being accepted typically is. So it is always recommended to apply early. And if possible, submit your application at least a month before the deadline. There are a lot of similar application requirements between DPT programs. However, there are some differences in application requirements. For example, two different programs might both require anatomy and physiology, but one might require that the course have been taken in the biology department, while the other program might accept courses from either biology or a kinesiology or exercise science department. Some programs require 3 letters of recommendation, others require 2. So it's important to pay attention to all of the details when you're starting your application preparation. Again, start by visiting ptcast.org and the program directory, as well as program websites. You can also feel free to call or email programs directly. They really don't mind hearing from applicants. In fact, some of them really like it. And then the last bit of advice I will give you here is don't wait for people to tell you what you need to be a successful applicant. Do your own research, ask questions, seek out information from people who can accurately advise you. Talk to your academic advisor, talk to professors, talk to PTs or PTAs in your community. That's really an important thing here to do. So once you've got your degree, the first step to becoming a PT or PTA is being accepted to the program, obviously. But once you have that degree, there's a few options that you have to explore your professional opportunities here. So the first is residency. A residency program is a post-professional planned learning experience comprised of curriculum that encompasses the essential knowledge, skills, and responsibilities of an advanced physical therapist within a defined area of practice. So what does that mean? It means that you're going to get really localized, focused education in one area of the profession, one area of practice. And we'll talk a little bit more about those in just a minute. Residency programs do prepare physical therapists with the requisite knowledge and skill set needed to pass the certification examination to become a board certified specialist, which is the next item here. Board certified specialists are certified by the American Board of Physical Therapy Specialties following a board exam. Board certified clinical specialists do have demonstrated advanced clinical knowledge and skills in one or more of 10 physical therapy specialty areas. Additionally, you could do a fellowship, which is a step beyond residency. Fellowship is a post-professional planned learning experience that comprises a curriculum that encompasses the essential knowledge, skills, and responsibilities of an advanced physical therapist within a defined area of specialty practice. So similar to residency, but even more localized and focused. We have a credentialed clinical instructor program. This program enhances clinical instruction education for PTs and PTAs who are interested in or involved in clinical education. We also have a leadership development program that the APTA Fellowship in Education Leadership provides, where attendees receive skills and resources needed to be an innovative and influential leader. And lastly, we have post-professional degrees. So in addition to earning a PT degree, as a clinical doctor of physical therapy, PTAs earn that associate degree. Some also do go on to obtain other degrees such as PhDs, MPHs, and MBAs. So as a physical therapist, you will be a trained clinician. However, there are multiple pathways you can choose within this profession. You can be a general practitioner. You can be a specialist in one of the areas we talked about. You can be a researcher, a professor, or a clinical educator. You can be an advocate, a policymaker, an entrepreneur, a CEO, a board member, and so on and so on. There's so many different combinations of things you can do. It doesn't just have to be clinical practice. So we do get that question a lot. There is so much that you can do outside of the clinic, including working for the association. We have numerous PTs and PTAs on staff here as well. So in addition to treating patients, there are other professional opportunities available to you. The APTA Physical Therapist Assistant Advanced Proficiency Pathways program was developed to increase a PTA's knowledge and skill in chosen area of physical therapy. So this is specific for PTA careers. Once it's achieved advanced proficiency pathway recognition, it's good for 10 years. And you can always find more information on this on our website as well. So why choose physical therapy? Obviously, there's multiple career options even within healthcare, but why should you choose PT specifically? If you love anatomy and physiology and muscle movement and exercise, or you're curious about the human body or movement in general, then physical therapy is a great career option for you. PTs and PTAs do more than help keep people moving. They, in some instances, help people regain their life. This is a video I'm going to share with you. This is the story of Adrienne Haslett, who was a victim of the Boston Marathon bombing. And with the marathon having just been run this year on this past Monday, it's especially appropriate to share this video now. So take a look and hear Adrienne's story.
When the explosions happened and my leg was gone, my biggest thing was, number one, staying alive. I mean, I really did think that that was it for me. I thought that my quality of life would be a zero. Mustering up the gut to be able to actually do it and feel my limitations was so tough. It was more mental than physical. My physical therapist completely understood that and knew that I needed the mental capacity to be able to do it, and she just kept my eye on the prize. Physical therapy means everything to me. You know, my physical therapist taught me how to walk again, and that taught my family and people around me that I was physically able to do anything that I put my mind to.
So you see there that Adrienne's physical therapist, along with the rest of her healthcare team, they didn't just help her to move again. They helped her to regain her life and believe again in herself and everything that she had before. That's what physical therapists and PTAs do. So PT is a personally, professionally, and financially rewarding career. In addition to helping people regain the quality of their life, physical therapy is consistently ranked as one of the top healthcare professions. It's the top ranked profession by US News and World Report in healthcare. It's number 10 best healthcare job and number 15 in the 100 best jobs. It's a profession that is predicted to continue to grow. People are living longer and they want to keep moving on their own as much as possible as they age. And physical therapists are needed to assist with that. The salary levels are strong in physical therapy. The median salary for a physical therapist is just under $90,000 a year, and the salary for PTAs is just under $59,000 a year. Physical therapy fosters relationships with patients. You saw Adrian's story there. Physical therapists on average spend more time with their patients than any other health professions do, with an average of 30 to 60-minute appointment times and potential for multiple visits that could continue for weeks, months, or maybe even years, depending on the patient's needs and goals. You're going to establish a relationship with your patient. It's also likely that you'll be able to witness your patient's progress over time. So if you're someone who likes to be able to see progress and note it and celebrate those small victories, then physical therapy will allow you to, really see the impact of your work over time. So what can you do now to start preparing for a future in PT? Do your research. Visit the APTA website or the PTCast website. Shadow or observe a PT or PTA to see what it's like up close. Diversify your experiences. If possible, observe more than 1 or 2 days in a variety of different settings and with a variety of patient populations. An experience in an outpatient orthopedic clinic is going to be very different from an inpatient burn unit or a cardiopulmonary clinic. So really try and figure out if you can see multiple different settings and patient types. Find a mentor, reach out to a local PT or PTA, or even a student at a local PT or PTA program who's willing to share their experience and guide you through the process. And then lastly, review your anatomy and physiology. I can't stress that enough. PTs are movement experts, and movement is based on an understanding of the muscles, bones, nerves, and etc. All those parts of the body and how they work together to create movement. So that's really important. And then build a strong science foundation on top of anatomy physiology. Science courses such as biology, chemistry, and physics are required to enter the profession, and you will rely on that knowledge as you go through your coursework. So to wrap things up, again, we've got a lot of resources out there that you can use to learn more. The first is the APTA website. There's the PTCast website. There is the PTAcast website. There's the CAPTI website. If you're interested in learning more about how to pay for your PT or PTA education and plan your financial future, we do offer tools for that in our Financial Solutions Center. And then lastly, reach out to us. We are all on our team here, happy to help answer your questions and find out if PT is right for you. So don't hesitate to email us at studentrecruitment@apta.org. You can also follow us to stay connected. We've got Instagram, Twitter, Facebook, YouTube. We're on everything. We've got LinkedIn, so we're out there. So follow us. But with that, I will open it up to questions and answers if there are any.
Well, thank you so much, Ryan. I think I speak for everyone when I say that I feel like I've learned so much just listening more about this profession. That being said, we do have a bunch of questions here, so
Sure.
I'll go through them and please feel free to answer as needed. So the first question is, do job opportunities prioritize newer doctorate PTs over the older experienced PTs that didn't get that doctorate?
No, they don't. Not that we've seen. We've as an association have done some studies on this, and really, I think I mentioned in the presentation that PT is a growing field. So there are plenty of jobs out there for those PTs that have been in the profession for a while versus those new graduates. So we haven't witnessed any favoritism or priority for new graduates over experienced PTs or vice versa.
So what bachelor's degrees do or should DPTs obtain? And do you have to be a certain major in order in undergraduate?
So that's a great question, and thank you for grouping those together because they go well together. In terms of the degree itself, honestly, it's such a mixed bag. Bachelor's of Arts, Bachelor of Science, you can do either. There is such a science base in terms of getting in that we see more Bachelor of Science, but more specifically talking in terms of major, I'm not going to lie, the most common majors we see are things like exercise science or kinesiology, but you can pretty much major in anything you want. We had a dance major this last year who got in. We've had business majors who apply and get in. The core thing to remember here is it's about those core science classes. As long as you're meeting the science prerequisites, you can study whatever you want. I have a good friend who works at the association who was a political science major and then decided to go to PT school and become a doctor of physical therapy. And they've melded those two together by working here in our government relations department. So they focus on policy and government relations specific to healthcare and physical therapy. So you can study whatever you want and get a degree in whatever you want. Don't feel like you're locked into sciences or specifically pre-PT or kinesiology. It's really whatever floats your boat.
Hmm. So can you work as a PTA while working towards your DPT?
It is very hard to work while you're in PT school. The courses are pretty demanding. You're going to have a lot of, in class work, obviously, but outside of that work. And then your third year, you're going to have your clinical rotations. So working through PT school can be a challenge. More commonly, what we see is someone who's finished a PTA degree go back and leave the profession to enter a DPT program. Or conversely, we will see people who think they want to go into a PT program, take a look at the time commitment and what's involved and say, maybe I'll just go back and do a PTA degree. So it's tough to do one while practicing or studying for the other. We don't see that often.
Do physical therapists diagnose patients, or do they treat injuries based on symptoms or from a referral from a doctor?
So both. PTs definitely diagnose patients. They are trained to clinically assess a patient and diagnose them with whatever is bothering them. In some instances, a primary care physician or another physician might refer a patient to a PT and say, this is what we think is going on. But ultimately, it's still going to be up to the PT to assess and diagnose what the actual physical issue or ailment is with that patient, and then put together a plan of care.
If I get my DPT here in the United States, will I be able to use my license outside of the United States?
We get that question a lot. So it honestly depends. The APTA is not involved in licensing. That is done on a state-by-state basis. So some countries will accept the licenses from some states, but it's not something where I can say, yes, you can practice outside the US, or no, you can't. It honestly is going to depend specifically on what state your license is in versus where you want to practice. Ultimately, most countries will say, if you want to practice outside the US and you've completed your DPT education in the US, that you are eligible to sit for whatever their licensing is. One thing to note when we talk about international, though, is the United States is the only country in the world that refers to the profession as physical therapy and as physical therapists. The rest of the world will refer to these as physiotherapy and physiotherapists. So if you see that somewhere, they are the same thing. The United States calls it physical therapy and therapist, but everywhere else is physio. Just something to note if you're looking outside the US.
And thank you for that clarification, Ryan. I really appreciate that.
Yeah.
As far as our next question, do you need to shadow in different PT settings?
So need to, no. Like I mentioned before, in terms of applying to DPT programs, a lot of programs, a significant majority, are either going to require or strongly recommend that you complete some number of shadowing or observation hours. Most of them, however, don't go so far as to say what you need to observe. They say you need to shadow a PT, but they don't specify it needs to be inpatient or outpatient, or they don't specify that it needs to be orthopedics or pediatrics or oncology, or they just say we want you to shadow a PT. So there's no specific that you need to shadow. It's more that you need to shadow someone.
Mm-hmm. So we talked a little bit about clinical, and we talked a little bit about didactic courses and things like that. Could you elaborate what didactic means in that situation? I think people have a sense of what clinical is, but if you could speak to more the didactic piece, that would be great.
Classroom learning. That's the short answer right there. So you're going to have in-class learning, which is the didactic pieces, which is separate from the actual going out into the clinic, working with patients. That's really the difference there.
How long are residencies and fellowships typically?
Typically, residencies are 1 to 2 years. Fellowships are about 1 year in physical therapy.
If you're licensed in all 50 states as a PTA, are there still any limits in working between states?
So because every state does their own licensing, we don't often see someone get licensed in every state. You would need to apply and sit for your licensing and pay to maintain that in all 50 states. But there's also some reciprocity. Certain states will accept a license from another state. You know, for example, I can tell you that if you're licensed in the state of New York, California is also going to accept your license. So there is some reciprocity there. Again, it depends on what state you're licensed in and where you want to practice. So something to look further into. And that's true of both PTs and PTAs. But as long as you're licensed in a state, you can practice in that state, and then you'll want to check to see if that license is valid in any other states.
Can physical therapists specialize in sports medicine?
Yes, sports is one of the largest areas of practice in physical therapy. So in terms of the DPT degree, you don't really go into specialties then. That would be done through completing a residency after in sports medicine, or completing a fellowship. And there's a few options. There is the two biggest ones for fellowships are upper extremity athletes, and then Division I sports athletics are the two fellowship areas. You could also become a board certified specialist in sports. That is an area where you can be a board certified specialist in sports physical therapy. And again, to do that, most commonly, you will have completed a residency before you become a board certified specialist.
All right, so I have a more specific question, but I'm gonna make it general for the audience.
Sure.
Essentially, you know, as we progress in age and things like that, how late is too late to pursue this type of career?
So that's a great question. I don't want to say it's never too late, but it's never too late. You know, the average age of DPT students is early 20s. It's within a year or two of getting a bachelor's degree at the typical time that students seem to get, that a traditional student gets a bachelor's degree. But that varies every year. You know, we put out an annual report every year that summarizes what did the applicant pool look like this year. And without fail, every year there's applicants that are in their 40s, 50s, and 60s. One year we had a handful of applicants who were actually in their 70s that were admitted to a program. So it's not too late at any point that you feel that you can physically handle the profession. That said, it is a very physically demanding profession. You're on your feet all day. You are physically working with your patients. It's a hands-on profession for the most part. So that's something to consider, but there's no age limit.
Perfect. There's a second part of that question, but I'm going to group it with this other question as well, because it feels like it's around the same theme. What's the best way to go about limiting student debt coming out of PT school?
Plan ahead, plan early, and plan well. So you saw me mention that we have some tools on our website in our Financial Solutions Center. There is a debt calculator and a loan repayment calculator. But understand early what it means to borrow money, and don't borrow money you don't need, because it has interest and you're going to pay it back. Plan ahead of time. Work if you can prior to PT school and save money. There's a lot of things you can do. And then as you're researching your programs, really compare. You know, every program has its pros and cons in terms of what they're offering you, and every person will find a right fit for them. And for some people, that might mean going to an in-state program at a state education facility rather than a private school, and saving some money on tuition that way. But do your research, learn what you're getting, assess all the costs, and start planning as early as you can.
So how are courses taken at community colleges or AP courses in general? How are those viewed by DPT programs? Are those accepted, or is it recommended that they take it at a four-year institution?
So for the most part, programs will accept courses from two-year community colleges. Generally, AP courses or IB courses, those types of things, are not accepted to fill prerequisites. They do want to see those at least at a two-year institution, if not a four-year institution. I will say with COVID recently, programs have started to lighten up a little on what some of their requirements were. So we are seeing more and more programs say it's okay to take a community college course or to have online courses, for prerequisites, whereas they used to be very hard and fast about it had to be an in-person lab at a four-year institution. So we're starting to see that shift a little. But again, I can't stress this enough. In the PTCast directory, every program will list their specific requirements for what the courses are. But one of the things they also share is, does each specific course that they list have to be completed at a four-year institution, or is a two-year institution okay? Can it be a general level course, or does it need to be upper division? Can it have a virtual lab, or does it need to be in person? Everything you'll want to know about the courses that a program is requiring is listed in that directory.
Can you talk about some of the specialties within PT?
Yeah, definitely. So there are a bunch of different specialty areas. Some of the more common ones. So we talked about sports. There is orthopedics. There is neurology. So you can go into the actual neurological side of physical therapy. There's pediatrics for those who want to work with a younger population. We have geriatrics if you want to work with an older population. One of our newest specialty areas is oncology. So if you want to work specifically with cancer patients, that's something that you can become a physical therapist specialist working with cancer patients now. It's really there's 10 different areas. I will direct you to the APTA website because there's a whole write-up about what each one does. But pretty much if it's something you have an interest in, you're able to do it through physical therapy. Because if you think about it, we work with the entire population, from neonatology, newborns in the neonatal, ICU, all the way up to hospice patients who are, geriatrics patients. So we cover the lifespan.
So how likely is it for DPT students to finish their degree?
Very likely. It is very uncommon for a student, once they've been admitted to a program, not to finish their degree. Every program is required to post their graduation rate, as well as their retention rate each year, and they are almost always in the high 90s, if not 100% for programs each year.
What's the best way to go about getting observation hours?
This is a tricky one because we had some good answers on this and then COVID happened. And so what I will tell you now is reach out. There's a few things that we always suggest. If you've been through physical therapy yourself for some reason, reach out to your physical therapist. They love to hear that their own patients are interested in going into the profession. If you have a family member, or a relative, a parent, a grandparent, a sibling, an aunt, an uncle, ask them if they've been through physical therapy and could they put you in touch with their physical therapist. If you are in an area that has a PT or a PTA program nearby, and again, every program is listed on our website, reach out to the program themselves and say, can you put me in touch with someone? Do any of your faculty practice outside? I would love to shadow them for a day. And the last thing is, this is old school, and so I'm going to update my reference here. I would have previously said get out the phone book, but hop online, go on Google Maps, go on Apple Maps, and search for PT clinics in your area. And don't be afraid to cold call a clinic. Search for physical therapy in your area. and call them and say, hey, I'm interested in entering this profession. One of the things we hear most often from PTs is, we want to help usher in the next generation of physical therapists and physical therapist assistants. And so they're eager to help with that if and when they can. So don't be afraid to just find a clinic in your area and call them and say, I'd like to come in for a day. And the one thing I'll add to that is because of COVID, we have seen an upswing in telehealth appointments where PTs and PTAs are seeing their patients virtually. So it might actually be easier to shadow in some ways now if you can get permission from a PT to do that virtual shadowing experience as well.
Do you think it would be helpful to take some of the social science courses like psychology, sociology, when trying to obtain a DPT, or
Yes.
as maybe right before it?
Yeah. So we didn't mention this in the presentation, but so many programs do actually require as a prerequisite that you take at least one psychology course, or in some cases even two. They love to see things like I mentioned just a second ago, because we work with the whole lifespan. They like to see lifespan development in psychology courses. So don't be surprised if when you're researching programs, if you see that you need, 1 to 2 psychology or any social science courses. Like I said early on, compassion and ethics and human relations and emotion are a big part of this profession. So having that social sciences background will help you.
So other than student loans to pay for DPT school, are there any other programs or any other initiatives that applicants can use to not only pay for tuition, but potentially even submit an application?
So there's a few options there. So in terms of paying for tuition, individual programs obviously offer their own financial aid packages outside of loans, whether that's scholarships or various other items. Those are done on a case-by-case basis directly with each program. So you would want to reach out to the programs that you're interested in to find more about those. In terms of applying, I would say the biggest thing is we do offer a fee waiver for applicants going through the PTCAS application. So if you have a demonstrated financial need, a PTA will cover the cost of your initial application to a DPT program. So we can do our part to reduce the application cost there. And then there are certain programs that we offer as an association that don't necessarily help pay for the program up front, but that you're eligible for once you get into a DPT program to help you pay back those loans afterwards.
Do you have any recommendations for how to prepare for specialization in patients with special needs?
To clarify, do we think we're talking? I'm going to assume we're talking here about becoming a specialist after you become a physical therapist to work with patients with special needs, in which case the thing I tell you is obviously once you're in a DPT program, you can stress that to your clinical professors, your clinical instructors, to say that's a population you're interested in. Most DPT programs have relationships with clinics all over the country where they place individuals for their clinical rotation, so they can try and place you someplace that maybe does more work with that population. But again, I would take a hard look at what the specialty areas are and try and decide if a residency or fellowship in a specific area is right for you, depending on what the special needs that you're interested in working with are.
Is there a special route one could take to become part of a PT team for a big name sports team?
I'm unaware of any special routes that lead to that. And honestly, what I'll tell you is most sports PTs don't actually work for a sports team. That's not necessarily what they do. Every sports team has a PT or two on staff, let me tell you, but there's only so many sports teams out there and there's a lot of PTs. So even in sports, but no, I'm not aware of any special route or anything, unfortunately.
What's the average acceptance rate for PT programs?
Yeah, so I'll be honest here, it hovers around the 50% mark. Somewhere between 50 and 55% of applicants are accepted each year. There's generally about 18 to 19,000 applicants to PT programs every year, and about 10 to 10,500 of those get accepted.
Is there a limit on how many times someone could take the DPT or the PTA licensure exam?
That varies state to state. So some states may let you take it multiple times. Other states may say you only get, 2 tries. It really varies. I don't think there's any state that says if you fail once, you can't try again. But there is a high end cap on that in some states.
And to stay around that same theme, do licenses expire? And if so, like, what's the process and to renewing it, and why do they expire to begin with?
Yeah, so they do expire if you don't take the necessary steps to maintain your license. So it's not that your license necessarily expires, but you'll need to do continuing education coursework to stay up to date on new developments in the field. So they're going to require you to demonstrate that you're using your license and that you have a certain number of patient care hours under your belt to keep that license. Same is true of specialization or board certification. And you'll also need to, again, complete a set number of continuing education coursework each year.
Perfect. And what's the average GPA for getting into a PT program?
So it varies across the many programs. There's over 260 DPT programs. If you want to, I can give you a number and tell you that it's in general about a 3.3, but that isn't necessarily reflective because it does range everywhere from, about a 2.7, 2.8 all the way up to a 3.5. So it's a range, but I would say a solid, B plus, A minus is the type of student that is getting accepted.
So how beneficial is it to speak multiple languages in this profession?
It can be very beneficial. That's actually a question we ask on the application each year. Is, are you fluent in any languages other than English? If you think about it, you are working with populations across the country and in some cases across the globe or around the globe. So depending on where you practice, if you want to practice in a more urban setting, you are likely to encounter patients that maybe don't speak English. So having fluency in another language, I live in the Northeast outside Boston, and I can tell you we have the largest population of Portuguese people outside of the country of Portugal. So it's insanely beneficial if you want to practice up here to speak Portuguese. Things like that, it can certainly be helpful, but that isn't isolated to just PT. That's true in probably any healthcare field or any field in general.
And to stay on the application field,
yeah,
what aspects or qualities set applicants apart?
There's a huge push towards holistic admissions in most of the health professions now, particularly in PT as well. And so it used to be that programs would look at your application and they'd look at 2 things, your GPA and your GRE score, and that's how they would decide who gets in. And that's not true anymore. What sets you apart is who you are. There's a lot of opportunity on the PTCAS application to share your story and your background. Where did you come from? Who are you? Who raised you? Did you work? What was your education experience like? What was your residential experience like? And then we have a personal statement that tries to get at this. So even if you don't answer any of those other optional questions, you have to write a personal statement. And our prompt right now is, what was the moment in your life that made you confirm your decision to become a physical therapist? A lot of times we hear things like, well, I went through physical therapy and that's when I decided. And so we've made sure to phrase that question more as, what's confirmed it? Not what initially made you want to do this. What was the thing that said to you, this is what I want to do. This is why I'm becoming a physical therapist or a physical therapist assistant. And answering that question honestly is a great chance to set yourself apart as well.
What's the typical day-to-day or the typical work hours for a DPT?
Yeah, so I mentioned briefly in the presentation that most appointments with patients are 30 to 60 minutes. Um, and depending on the clinic you work in, you might see 8 to 10 patients a day. Um, so a typical workday is you're seeing patients for those 30 to 60-minute appointments. You're working hands-on with them. And then at the end of the day, or after each appointment, or at the end of the day, depending again where you work, you're charting and making notes and leaving records of your visits with each patient. So they can be long days, but it really does depend on the setting you work in. If you're in home health care versus a hospital setting versus an outpatient clinic, you might work, 6 hours as a home health aide traveling from patient's house to house versus 10 hours or 12-hour shifts in a hospital setting. So it can vary depending on where you are and what you're doing, but figure 30 to 60-minute appointments, somewhere between 8 and 10 of those a day in time for charting and note taking.
So can someone become a PTA while trying to obtain their bachelor's degree? And if they can, like, are there any requirements and should they pursue that?
So because a PTA is a 2-year degree, you obviously, it's an associate degree. That said, there are some programs that may take a little less time than that, some take a little longer. You can get your PTA and then go on to a bachelor's degree, but trying to get your PTA while simultaneously trying to get another bachelor's degree could be pretty tough, again, just because of the demand in terms of the coursework and the clinical education that you're going to go through.
Perfect. So what's the difference between in and outpatient for PT?
So inpatient refers to pretty much some place that admits their patients for overnight or extended stays. So think hospital, nursing home, rehab facilities, hospice care, versus outpatient, which is a clinic where you go in for your appointment, you see your PT, and you leave. So those are the big difference.
Perfect.
But I'll just say in terms of practice area, you're going to see pretty much all of the practice areas in both types of settings.
And last but not least, do you have any final words, a piece of advice, for anyone trying to pursue this profession?
Yeah, the thing I tell anyone who is looking at this profession is before you go into it, make sure it's what you want to do. It's a big time commitment. And this is probably true of a lot of different health professions. I've worked in multiple in my career. The thing I see with PT is you almost need a certain level of compassion that you might not necessarily need when you're in a different healthcare field. They're all compassionate people, but you're spending so much more time and your relationship with your patients is so strong. And it, like I said, it can last anywhere from weeks to years. So know that you're the type of person who isn't just getting into this to physically help someone, but realize that you're probably going to have some sort of emotional investment or attachment to your patients. And if that's not something that you're interested in, that isn't to say don't go into physical therapy, but really think about how you want to handle that. Everything else is numbers and studying and courses and shadowing and preparation. That's something that only you can answer for yourself. So before you go into this, sit down and think about why you're doing it and make sure it's what you really want to do. But understand it's truly rewarding if you do.
Thank you so much, Ryan, for an amazing session, for the Q&A, just for the entire experience. Honestly, I feel like I have a better understanding about this profession. And, I know for a fact that our audience does too. That being said, this recording will be available on our YouTube channel within 5 business days. I've dropped a link in our chat, so if anyone needs to access it, feel free. And that's it for this evening and for this session. Thank you so much, Ryan, and everyone, and have a great evening.
Thank you, Tony.
All right. Bye.